I'm absolutely delighted to be here today with Dr. Ronald Ruden, the creator of Havening Techniques. Welcome, Dr. Ruden, and thank you for doing this.
My pleasure.
Good. Good to have you. So tell us, what do you think Havening Techniques are?
Well, you have to understand that we come from a different perspective. The treatment of mental and emotional disturbances as well as physical disturbances are generally done by either medications or talk therapy. Medications changes the chemistry of the brain. In Havening Techniques, what we do is change the electrical system of the brain. We kind of rewire the circuitry, so to speak, to provide a way to make the body more in balance.
Right. Great. Like that answer. It's a good one. So what are the benefits of Havening Techniques, in your opinion?
There are many. The way we started this was that we used it mostly to treat encoded traumatic events. That is to say, something terrible happened in it, and it haunted people for a long time. And by using Havening Techniques, we were able to disconnect the emotional component of the event from the event itself. So although they could remember it, it wouldn't have that emotional power to it. And that decreased a lot of the stress in individuals. But we also found that we could use it to be very positive in people's lives. We have something called affirmational havening, which allows us to put into people's brains positive thinking about the future as well.
Yeah. And that's something I use an awful lot of in my practice. It's sort of prescriptive in between sessions or after a session for them to take away and do. And I know that you've been doing a lot of research around this, and you have one affirmation that I really like. I can choose to. Yes?
Yes, it's a very empowering sort of thing. Most of the time we feel helpless floating down a river on a raft without oars or without a rudder. And the I can choose component, I can choose to be happy. I can choose to open my mind to learning. I can choose to open my heart to friendship. I can choose to feel safe, peaceful, and calm. Very empowering, and it's phenomenally effective.
Without giving too much away, I know that you're teaching some young children in the classroom to use this, and you're getting quite good results, aren't you?
What's fascinating is that, and it actually surprises me, one of my young students, or actually clients, is about 8 years old, and he struggled for a long time with anxiety in class. And he was at a much lower level of reading. He didn't raise his hand in class, and he didn't do well in spelling. He was just, or reading, and so we thought, well, let's see if we can downregulate his stress by using Havening Techniques. Maybe things would improve. So we taught him a little mantra, and he does it by himself. His mother sometimes helps him along.
Right.
And his reading has now skyrocketed up where he's reading at grade level now. He's raising his hand in class, and he's had no anxieties for the last 2.5 months. And he's only been doing this for about 3 or 4 months altogether.
Yeah, thank you. I love that story. That's great. I wasn't even aware of that. I was thinking more of the children you're doing in the classroom. You're teaching them in this classroom. And it's actually improving their learning skills and their concentration and focus.
We believe that stress plays a large role in inhibiting learning. If you can make it so that the children are not stressed and open then to receiving things, yes, it helps tremendously.
Yeah. And is anything we want to get them when they're young, yes?
I'd like
To
to
help
start
make-
in first grade or
Right.
even before, kindergarten. I mean, this is not a hard technique to learn, and the teachers can run this in the beginning of the day with a 2-minute Havening chant, and then they're done for the day. And since the students do it to themselves, if they ever get anxious or they become distressed, they can go to a corner of a room and spend a minute and down-regulate the stress.
Right. So for our viewers, I'm just going to do a little quick demonstration of what it would look like. So you would suggest they do arm havening, yes?
Yes, arm havening is
Like this?
Starts at the top of the shoulder,
Right.
and goes down to the elbow,
Okay.
and then is lifted up exactly like
Like
you're
that.
doing it.
Okay. And then they would say,
They would say, for example,
give me an example and I'll do it for you.
okay, I can choose to open my mind to learning.
So I'm going to close my eyes because that's the
Okay.
best way of doing it, isn't it?
Yep.
I can choose to open my mind to learning.
I can choose to open my heart to friendship.
I can choose to open my heart to friendship.
I can choose to feel safe, peaceful, calm.
I can choose to feel safe, peaceful, and calm. Really nice.
And your viewers may feel calmed by themselves because we have something in the brain called mirror neurons, which allows us to experience what you're experiencing just by observing.
Right. And they could probably, if they're really, really clever watching, they can see physiologically I've changed a bit, haven't I?
Yeah.
I've calmed down because I can feel it. I can certainly feel it. Probably my skin tone has changed a bit. And I couldn't resist smiling at the end of it. So that's a good thing.
Well, just imagine doing this every day in class to start the day off. And, you know, the original stuff we're doing is in inner cities where there's a lot of stress involved with, you know, poverty and violence in the home. And so if we can bring this into the classroom and it's benign, it's safe, and down-regulate the stress for these young kids, I think their learning is going to be really enhanced.
And I think it's a very challenging time for all of us at the moment. There's a lot of unknown and insecurity in our world. So I think their parents could benefit from it as well. Definitely.
I happen to like hopeful havening. I think having hope is the key
that's a good one.
To really feeling that change is possible.
Right. So that would look like this, right? I am hopeful, and then they would finish the sentence with whatever they want to have more hope for, yes.
Hopefully I win the lottery today. Hopefully I win the lottery.
And hopefully these governments sort themselves out, yes.
More than that, but hopefully politicians do their job.
Exactly, and make good decisions for all of us.
Yes.
So my final question is, what is the future of Havening techniques?
Well, it is my belief that it can be used by everybody. It's very easy to learn, and people can use it to down-regulate the stress. Who doesn't have stress during their day? And so it can be used universally to allow people to be happier, healthier, and essentially more confident in their lives.
Absolutely. And there is one more question, if you don't mind. Is there anything that you'd like to share with us that I haven't asked you? Is there anything about Havening techniques that...
I would say the biggest thing is that people are skeptical. Because sometimes we do things which occur so rapidly, remove trauma, which has been around for decades, that it's hard to believe. And people are skeptical. How could this be? How can something as simple as touch do this? And my response to them is, be an open-minded skeptic, not a closed-minded skeptic. Try it, see if it works for you. If it does, then you can use it.
And it's so true. I was skeptical when I first learned about it, and I tested it myself on my blood pressure because I actually could measure my blood pressure before and after. And I'm very low, usually. Had some hard news, put the cuff on. I was about 172 over 102. Did some havening, self-havening. I am calm, I am relaxed. I did it for about 7 to 10 minutes. This was at the very beginning when I just heard about havening. And I put the cuff back on and I was down to about 120 over 78. And that was 7 to 10 minutes of self-havening. And that's when I really knew this worked.
Wow.
Yeah, it was great.
Throw out the drugs.
Absolutely. Wait, it's absolutely true. And not that I ever recommend this for any of my clients, but I do get clients coming back to me and saying, I have reduced my medication. I always make sure that they've checked with their doctors, and I never encourage them to do that, but they feel that they don't need as many drugs or any of the drugs anymore, which is our goal.
I think, again, the idea that the brain's an electrochemical organ, and we're using the electrical system of the body, not the chemical system of the body, which has been traditional Western medicine. And so it's a whole new paradigm we're looking at here of using the electrical system. And since we use touch and affect the brain, we call Havening techniques a psychosensory technique.
Right. Which is mind-body connection, yes?
Absolutely.
Unlike the other pillars of therapy, yes?
Like talk therapy or drug therapy.
Right.
This is a psychosensory therapy where we use sensory input, which creates an electrical wave in the brain and then changes the circuitry of the brain permanently, sometimes permanently, sometimes you need to do this over again if you want to do resilience training, for example.
Right.
But the idea here is that we change it electrically. And that's pretty cool.
It is pretty cool. And I think on that note, we will end there. And thank you so much for enlightening me and the audience about Havening techniques. Thank you very much, Dr. Ruden.
You're welcome.